Okay, well, hello everyone. Welcome everyone to our webinar today, a virtual town hall part 2, shifting COVID-19 approaches for the next phase of the pandemic. The CDC Foundation is pleased to host this webinar in partnership with the Vaccine Equity Cooperative and Health Leads. This webinar is the 11th in a series and is part of our ongoing work and commitment to support those of you working in communities and partnering with communities to fight this pandemic. I am Dr. Lisa Waddell, the Chief Medical Officer for the CDC Foundation, and will serve as your moderator for today's webinar. Next slide. Today's webinar is available in Spanish. To listen to this presentation in Spanish, click the globe interpretation icon at the bottom of your Zoom screen and select the language. The webinar also has a closed captioning option. To enable closed captioning, please click on the closed captioning icon on the bottom of the Zoom screen. Now, some housekeeping before we begin our conversation today. Today's webinar will be recorded and sent to everyone who registered along with any materials shared. During today's webinar, we will have time to answer as many of your questions as possible. So please submit all of your questions using the Zoom Q&A button found at the bottom of your screen. You can also use the Zoom chat feature to just share comments, reactions, links, resources with your fellow attendees and panelists. And then finally, at the end, we will be launching a poll and evaluation survey. So we really appreciate you taking the time to share your feedback on today's webinar and suggestions for future offerings. Now, before we get into our topic for today, I don't know about you, but I certainly am deeply saddened and quite frankly outraged by the events of yesterday. As a mom of a 4th grade elementary school teacher, and having seen the group picture of those beautiful children and my son, the teacher, I can just only imagine the heartbreak and what's happening down in Texas. Folks, this is not okay. We have a gun violence problem in the United States. This is not acceptable. Enough is enough. And as a public health community, partners and everyone, we absolutely have to ensure that more action is taken to prevent this. It's Texas, it's Buffalo, it's out in California, our elderlies, people just practicing the religion and the faith that they believe in, and then our children. It's not okay. So I want us all, and I know that you all like me, certainly are sending our prayers and our thoughts and reflections and whatever we can think of to support the community. But that's not enough. We need policy and systems changes, and we need it now. Enough is enough. So let's move forward for our topic for today. As we continue our conversation from last month, we wish to focus on building upon the tools we have and learning from each other. Our goal today is to provide as much insight as we can surrounding new variants, testing, mental health, long COVID, and more to help keep your families and communities safe. So today's webinar will answer your questions around these topics. To do this, we are thrilled to have a number of expert speakers with us today, and the links to their bios are found in the chats, and you can see their pictures on the screen, and you'll see them in live person in just a moment. So now we're going to get our town hall started. We're going to transition to a discussion and questions and answers with our panelists. So if we can bring all of our esteemed speakers on screen, that would be great. We want you to see them all. Okay. So to get started with our conversation, we'd like, well, let me make sure I introduce you first. Let's go back. All right. So first we have Dr. Noha Abalata. And her friends, family, and patients all call her Dr. Noha. So we're going to call her Dr. Noha today, and she can wave for us. We also have Alex Fajardo. We are so pleased to have you with us, Alex. And then we also have Stephanie Takamura with us today. And again, really invite you all to review their bios and see all of the great work that they're doing in communities across this country. So let's learn a little bit more about their organizations and what they're doing. So if you all could get us started by telling us about your organization and the communities that you serve. What has your COVID-19 response and vaccination outreach strategy looked like? And so, Stephanie, I'll turn to you, then to Alex, who's got his hand raised. Well, I think he was just waving to us. And then Dr. Noha. So, Stephanie, let's start with you with the Marshallese work.
Thank you, Dr. Weddle. My name is Stephanie. I'm the project manager here at Arkansas Coalition of Marshallese. The Marshall Islands were the 7th smallest nation in the world. And so we're very tiny, but before the missionaries came into our islands in the 1800s, we actually are a matriarchal society. The reason why is it's guaranteed through the bloodline. Our children inherit the mother's clan, the property, everything is passed down through the woman's lineage, which is going to be guaranteed through the bloodline. So here at Arkansas Coalition of Marshallese, this pandemic has been just horrible. It's taken a lot of our people's life, and our community thrives solely on family gatherings. So we have centered our vaccine COVID events on mothers. And because at the end of the day, us mothers are the ones that will tell our family to get vaccinated. So we've had events like Zumba Mamas, where the Zumba moms helped us cater a vaccine event. We've had Cookies with Santas. We've had many other events that we had catered to where mothers can come in, pick up dinner because dinner was ready. So yeah, I'm definitely. I'm
gonna lock the door, but that
thank
door
you.
is
Hello, I think I'm next, right? Hi, everyone. My name is Alexander Fajardo. I am the director of a nonprofit organization called El Sol Neighborhood Educational Center. We are a nonprofit led by promotores community health workers from all of the aspects of the agency, even having promotores in our board of directors. We are located in California. We do direct services in San Bernardino and Riverside counties, but we do a lot of technical assistance and trainings to CHWs and promoters across the nation. Related COVID, we developed a spectrum of intervention that was developed through the pandemic, but we ended up to having 7 levels of interventions. The first one is outreach, and we have many ways to do outreach. The second one was education. The third one was linkages, so linkaging people to services, providing what they need. The next one was social support, when they, in all of the stages of the COVID, the pandemic. The next one was testing. So we were trained by the county. Our promotores and community health workers were going door to door doing testing with a team working with the county. And also we provide sites, vaccine sites through different places like churches, isolated communities. And now we are in the phases of resiliency and recovery and healing. And then definitely can get more into us as we go today in which strategy we use in each of these interventions. That was a result of having meetings with the community, with our community health workers. These interventions were towards the community, but internally, we develop our own strategies in how to maintain our staff, really strength, mental health support, counseling throughout the pandemic. Thank you.
Hello, everyone. I'm Dr. Noha Abalada, and I'm the founding CEO at Roots Community Health Center. We were founded in Oakland, California, and now serving both Alameda and Santa Clara counties in California. And our mission is to uplift those who are impacted by systemic inequities and poverty. And we provide direct medical services, behavioral health care, health navigation. Our navigators are community health outreach workers, a lot like the promotoras hired from the community, trained, and really much of the glue of the work we do. And we have workforce enterprises, emergency workforce housing, outreach, and advocacy. And when the pandemic hit, as a community health center rooted in a community that we knew would be left behind if we didn't step up, we stood up the first walk-up COVID testing site in the Bay Area, very low barrier, and then subsequently a vaccine site. And so we continue to operate fixed testing and vaccine sites. We've done over 40,000 COVID tests, around 20,000 COVID vaccines. And we also started early on because of all of the confusion just around information with the pandemic. We really sort of took it upon ourselves to make sure that we were communicating directly with our community about the best ways to inform themselves and keep themselves and their loved ones safe. And so we started a number of different avenues around communication, including a health briefing. We call it the People's Health Briefing, and it's continuing to air. We started in July of 2020, and it's every Tuesday morning at 10 a.m. on Facebook and YouTube Live. And that is where we're able to disseminate really kind of up-to-date information about what is going on with the pandemic. And then in addition to that, we have done quite a bit of just public health education, both through videos and social media and billboards and mailers, but also just through really staying in communication with our community, finding out what are the questions that they need answered, and really kind of staying as timely and in relationship with our community as much as possible so that we can kind of help cut through that information. And then lastly, I would say in terms of the COVID response, we've really formed a number of partnerships that I think increase our public health education safety net, including our Barbers Advisory Council, and working in partnership with them, not only as small businesses, but as trusted people within the community that are having conversations on a daily basis that can be informing and educating conversations rather than continuing any confusion or misinformation. So that has been a really important strategy in terms of realizing that our health communication safety net is more than just doctors' offices and more than necessarily, even our public health departments, but that is really all of us arming ourselves with the proper information and working together in that way.
Okay, so well, that was a great start, because I know I heard a number of things in terms of tools right from just the start here. A focus on mothers. So if there are community-based organizations on the call that are focusing on moms, women of reproductive age, reach out to Stephanie's organization and consider some Zumba. That's good for all of us. Zumba mothers. With El Sol, the notion of how to work with promotoras, taking into consideration mental health for the workers, and a variety of strategies that Alex and his team are focusing on. And then from Dr. Noha, make sure you mark this down, the People's Health Briefing on Tuesday mornings, a Barber Advisory Council, trusted messengers, and key partnerships. It's all of us. So let's keep moving and get through your questions, but I wanted to definitely recap those key things for you. So Dr. Noha, can you share any information or updates about the latest variant that's taking over the country, BA 2.12.1? What are some of the key points that we should be communicating to our community when it comes to variants, but in particular, their questions about this latest one?
Yes, so yes, the names are getting longer and longer, aren't they? Sounding like a IP address or something. And so this latest subvariant of Omicron is looking to be more contagious. It's displacing quickly the BA2 variant, subvariant. It doesn't necessarily appear to be more deadly, but that calculation is getting harder and harder to really do as we're talking about a mix of people who are partially vaccinated, fully vaccinated, vaccinated in one booster, vaccinated in two boosters, or unvaccinated. When it comes to our unvaccinated population, COVID has really remained just as deadly, even with the Omicron variant, and despite the narrative that seemed to try to take hold within the media. When we really start to dig down into the data for unvaccinated, unprotected people, particularly those who've never had COVID before, it is just as deadly. So unfortunately, we still are losing people from SARS-CoV-2. And I think what we need to know about variants just in general is that the more we lift the mitigation strategies, the more we continue to travel, particularly unmasked, the more that we have gatherings that are crowded, especially those that are indoor where people aren't masking, we will continue to have transmission. And as long as we continue to have transmission, we will continue to have variants and new variants. And I actually think that one of the most important things now to be, concerned about is not so much the ones that we have now, but the ones that we may have in the future, particularly if they evade our prior immunity. And unfortunately, BA2.12 also is evading our prior immunity from, if you had Omicron, the original Omicron, your antibodies don't look as good even against this variant. And that's just something that we're going to sort of, potentially continue to grapple with. So I think now the name of the game is identifying them early and being able to act on it quickly, including assessing whether our treatments are going to continue to be effective against them. And so that is becoming an elusive goal, really, because so much of our surveillance is falling away, unfortunately. And so we're having to really, I think, dig into different strategies around staying ahead of the curve on this, because what we don't want is to be blindsided again, as we just were. I mean, if we really would like to recall just a few months ago, so that we don't get blindsided again by another variant that either evades vaccines or prior immunity.
And I think, thank you. And I think that, you've sort of teed this up around, this issue around mitigation factors, right? And, a number of our attendees, indicate that there's still, confusion around the difference in national data and guidance versus what's happening in their local communities. The national data and guidance, shows that 75–80% of the country's community 19 COVID levels are at low risk, right? For COVID, the communities are at low risk, but at the same time, locally, there could be high case counts and no masking guidance. So how are you, or how can we continue to help communities navigate these differences and understand when to continue masking?
Yeah, it's a great question. And many of us have not stopped masking because I think we recognize that despite the fact that the CDC has elected to change how they're talking about risk, that doesn't in and of itself change the risk. And so, in fact, we did a short video, and all of our short videos are on our YouTube channel. We did a short video saying, just because the CDC changes, we've got this green, beautiful, soothing sort of map that is really about an indicator that we know is very late, which is hospital capacity, essentially. And you have to really scroll down and really work hard if you want to get to the real map, which is the map that's actually showing community transmission, but it can be done. And so part of our, wanting to make sure people know how to get to that map, because it can tell you what community transmission looks like within your county, within your area. And many of the counties have, of course, their own dashboards. But we know that the utility of these things, we know that we're seeing a lot of undercounting now because so many people are testing at home. And so even the map that currently is mostly red, it's mostly fire engine red right now, the community, transmission map. And the community level map, which is the one that tells us that we're in dire straits. I mean, if we don't have enough hospital capacity, that is, a real, serious emergency that goes way beyond COVID, right? And so I think that framing by the CDC, I think is challenging because it confuses the picture. And those of us on the ground trying to explain that, no, that doesn't mean that It actually doesn't necessarily have to mean anything about transmission, because there are places that their hospital capacity and their regional capacity is such that they won't reach those levels on that map. That doesn't mean that the transmission is not of concern. And so what we've had to do is start looking everywhere we can. And I'm literally getting information from, I'm looking at the school district, I'm looking at the wastewater, although unfortunately that is kind of all over the place as far as how useful it's going to be, but there's a lot of promise there. So I'm definitely hopeful that we'll be able to leverage that technology one day. I'm looking at the hospitals, because a lot of our hospital systems, they do testing for people who are coming in, let's say for elective procedures. So knowing what the asymptomatic positivity rate is helpful. So I'm getting these data fragments from everywhere to understand what's happening right here locally in our area. And unfortunately, that's sort of a bit what we're left to do. And we can look at positivity rates. We can look at the 14-day case rates and see the direction it's going. We know that's not a good thing when it's going in that direction, which it is currently now. And then unfortunately, the things that we are going to stay on top of collecting, hospitalization and death, are too late to tell us it's time to mask. So we can't really look at those indicators to say when it's time to mask. So I think it's really a lot more about understanding two things. I think your own personal risk, and that includes those around you and those that you may put at risk, and then the risk of the situation that you're going to go into. And based on those two things, what are the mitigation measures that you're going to have to use? And there are so many barriers. So a lot of our education, or so many variables, that a lot of our education is about those nuances, right? Is everyone vaccinated? Is everyone unvaccinated? Is everyone boosted? Do we have masking in common areas? Is it indoors? Is it outdoors? Where's the eating? Where's the drinking? So really giving people the tools to be able to assess their own situation, and then trying to give people tools to assess ventilation is very elusive. And I think is very difficult to just do as an individual person. And I think one of the places we really need to go next is to have some standards around indoor air quality and safety of our indoor air, especially in our schools, but really in anywhere where we have people gathering. And so I think that that's another next step.
Great, thank you. One of the things that you mentioned is just around, again, all of these sort of mitigation factors, right? And this is summer, but we'll soon be heading into winter, and we still have flu. So I think that all of these mitigation factors, washing your hands, masking, are things that can protect us from other respiratory kinds of illnesses also. And so that's an important message. And then I think the other piece that you also mentioned is this piece around hospital capacity is really important also, because if you all recall, there were increases in chronic health conditions, right? Particularly around like heart attacks and those sorts of things during the pandemic. And so because people couldn't get into care. And so we do want to make sure that everyone's paying attention to those issues also. All right, so removing barriers is key in gaining trust and confidence for folks who aren't yet vaccinated. And we know that while we've made progress in vaccination, there's still a lot of work to do. Can you share what approaches have been effective in reaching members of your community, especially for those that have seen and heard information but are still unvaccinated? And this has been a common question that we've received. People are still challenged by the issues around those that are not vaccinated, and what are some of those tools, those strategies to continue to try to reach them, given the significant difference in outcomes of persons who get severe disease and subsequently die if they're unvaccinated. So Alex, if we could start with you and get your perspective on that, and then Stephanie, and then Dr. Noha.
Thank you. I think we have learned too much, a lot through the pandemic. We have been doing a lot of community work for almost 30 years, but this pandemic challenged us to do something different, especially because the work done with the community health workers is really about relationship. So I think one of the major successful that we have is understanding that without relationship, we cannot have change. So it's super important that we develop these strong relationships with the community. I'm going to share very quickly here something just to have an idea to show you how we have been working for in the last week. So one of the things that we developed, it was kind of our superhero. So they are the community health workers, all of them, and then we had like cartoon idea, and we do a community theater in the community. You guys can look at it later on. And we came up with some ideas of the comic strips that were super helpful, very well developed, and for kids, powerful. If parents has been still calling us, hey, can I have another pamphlet? Can I have another comic strips? We have the Battle of the Millennium, very good playbook and comic book story for kids. So when they are waiting on the waiting room or at the schools, we are giving these kind of activities. So this is something in Spanish and English. We develop other things. The other toolkit that we developed, it was the Time to Heal. So it was in partnership with the African American and Latinos to send a message that we need to have to work together and we need to recover. Very good toolkit. You guys can look at it. We have toolkits there that people can use, like recovering from COVID, emotional healing map. Very, very good. And another other thing that we did at the beginning of the pandemic was the COVID Sun official. Very nice, very funny, powerful. We are still using it. Big communities are still using it. Churches are using it. Radio are using it, and they have this kind of messaging in that song. So we have like 3 minute songs, but we have a little lyrics and spat for the topics that we were covering. So things like this has been super innovative to at least to engage the conversation. So it's not just giving a flash, it's really, hey, did you see the show? How did you like it? And it started a conversation about to bring this kind of awareness, the importance of the vaccination, all the recovering, all the testing, depending on the phase of the pandemic. So I think I just want to share a few little things that we have done. And then you guys can look at it later on too.
That's great, Alex. Thank you so much for sharing those resources. Stephanie, let's turn to you.
Thank you, Doctor. Yeah, so I want to talk about from our islands back. So I want to introduce what happened back in the 1940s. Our islands were tested with when the nuclear bomb first came and they needed to test how nuclear atomic bombs would work. So they actually utilized our islands, and the word bikini, the two-piece outfit, actually came from our islands. That's the island's name that they actually tested the nuclear bombs on. So in 12 years, the American had tested equivalents of 1,000 Hiroshima bombs. So since that's happened, we are displaced from our islands. So a lot of our folks are here in the Springdale location. We're averaging about 15,000 Marshallese here. So the distrust is already there with healthcare, anything that comes from the government for help. So it's already there. So what our strategy with ACOM, we have actually hired 2 Marshallese speaking nurses. So having these mother nurses come to our vaccine events has literally given us a 99% chance of our people actually will get vaccinated, just because the trust is key in there. And so our Marshallese nurses, when they're on site, they have, I've seen pregnant mothers, just like, I'm scared to get vaccinated. And then after sitting with the mother nurses, they'll get vaccinated. So we're very blessed in having these 2 Marshallese speaking nurses with our staff. It's been a very successful rate. So again, the trust has got to be there. So we continue to serve our people. Even patients will turn into clients. So a patient that's been quarantined for 2 months will call me and say, Steph, we're out of food. So now I can turn around, we have food pantry. So we'll turn around and deliver food to them if they were in isolation. So yeah, we're definitely blessed to have the Marshallese speaking nurses with us. And we continue to look forward to serving more of our people.
Thank you. That reminds me again, the respect, right? The trust, the relationships, the coming from the known community. There have been some communication strategies, particularly like, for example, with the Native American community around using the respected elders and the known respected elders. So I think what you're describing is just really, really important. Dr. Noha, what would you like to add to this conversation?
Yeah, I think the partnering, everything you just mentioned around really connecting a lot of dots around respected messengers within the community, whether it's our faith leaders, whether it is the elders within our community, whether it is our barbers and beauticians, and our doctors, of course. And so I think, making sure that we are in communication with one another and aligning around not only what do people need to hear and need to understand, but what are we hearing? What are the most common barriers and objections, and how can we overcome them? Because I think from day one, we recognize, yes, the mistrust, we know. I mean, that's actually why Roots was founded and formed in the first place, is to be able to be that trusted place within the community where people can receive not only healthcare, but health information, and where they can advocate for themselves around whatever their needs and goals are around health, not just with COVID. And so for us, this was just building upon a lot of that trust that we had already formed within the community, but also then sort of broadening our reach by having these partnerships. And one of the things I think that's been so critical, because so much of the pandemic has really become very politicized, and there's a lot of judgment going on. And being in the space long before COVID, that's the first wrong thing to do, is to be judgmental and get frustrated and impatient with people. We don't get to do that. I don't get to, just because I see you the third time and you're still smoking, even though I already told you 2 times that's bad for you. And I'm going to keep bringing it up every time. Okay, you're still not ready. Okay, just know I'm going to bring it up again next time. So same thing with, I think, the vaccine, same thing with understanding that we knew it was going to take a while for our community to decide, okay, I have enough information now. But that also doesn't mean we're just going to give up and say, okay, you want to be part of the problem. No, that is doing further damage, especially when we understand the context and the historical context around why we're in the situation that we're currently in, not to mention the contemporary context, which says, oh, they're giving me a vaccine for free. Like, when was the last time I got anything for free? So that in and of itself just builds the mistrust. You never cared about my health before. Why all of a sudden are you so concerned with me getting this thing you just made put into my body? So those are real, those are real valid, expressions, I think, of how folks were feeling. And so for us, we just knew this is going to be a long game. We celebrate every time we get someone, this month alone, actually a little over half of our vaccines were primary series vaccines. We celebrate that because yes, we know as soon as the new booster is authorized, we're gonna get a lot of folks from, a lot of different communities coming. But when we get our folks in our community to get that first dose, that for us is just a reminder that we don't get to give up. People are changing their mind every single day for their own reasons. And, my biggest thing is sort of, if you're saying you're waiting, because we hear that a lot. Well, I need to wait and see. We still hear that. What are you waiting for? What information do you need? Let's get you all the information that you need, but we will not give up on you.
Thank you, Dr. Noha. I think you just hit on something that's just so important. I mean, we have to be patient and persistent, respectfully. We do need to celebrate. I mean, all of our community-based organizations on this call, the health department and all the partners have been working so hard. And so it is important to celebrate, the progress that's being made. But yeah, we're still have some challenges. We're sort of in the 6th wave, if you will, of this pandemic, and we're seeing cases starting to ramp up again across the country. And so what is your current strategy for overcoming COVID fatigue and continuing to support and protect your community? Stephanie, can we start with you?
Yes, thank you, doctor. So I've mentioned our martially speaking nurses that we do have on staff. One of the things everyone knows, cost of living is going up, groceries are going up, gas prices going up. So one of our strategies to kind of encourage people, we're incentivizing our patients to come to our vaccine events, so that way they can get, majority of them are on the poverty level, so they can't afford gas. So coming to our vaccine events, they get the gift card, they can go pay for gas. So we're definitely still servicing our people in the different ways we can to overcome COVID fatigue. Another strategy is we have our 2 marshals nurses that I've spoken about before. We do Facebook Live questionnaires and just kind of update people on what the new CDC guidelines are. We know that there's a second dosage that's out now, so we will do our Facebook Lives to keep our people updated on what the updates have been. So we have our staff. I know that we have currently now even have one day out of the month where we call it SelfCare Day, just because we do get COVID fatigue from our work line. So my executive director was more than generous to give us at least one day out of the month to get SelfCare Day, so we can just, as staff and my community health care workers, we can just take one day off and take care of ourselves and just sit back and relax. But yeah, it's important that we take care of ourselves as well, including our patients in our community. Thank you.
Self-care days, yes, indeedy. Using in incentives and being available to share that information through your Facebook Live. Excellent strategies. Alex and then Dr. Noha.
Yes. Okay. So for the community, we are not really going too much going door to door or how we used to do it. Right now, we're using more like wellness topics per se, or Zumba classes, or games with the community. And then even though through that process, we still talk a little bit about COVID at the end, or any questions. And also, more than just giving information about vaccines, did you get a vaccination? Did you get a vaccine? Did you get a booster? It's more like how you been? How's everything going with you? And we have been noticed a lot of people actually are looking for super groups right now. I think is what we're trying to do right now, is more like a support groups, hearing the community, listening the community, having the community create this space to reflect of what happened last year, or the grief that they need to pass, because many things has happened. And also for the staff, I hire an external mental health expert to support our team. So that person is available. So anyone who wants to have this space with her, I think is super important. I think one of the things I'm seeing right now is taking care, and I'm glad that Stephanie also mentioned taking care of our staff, creating this space for them. It will be powerful in order to keep going. I think that's what we're doing right now.
Those are great strategies, because this may be going on for a while. And so we've got to be supportive, the mental health support, the support groups, allowing people to talk about this experience and focus on wellness also. Dr. Noha, if you want to add to that, and then I'm going to ask you if you would maybe also transition to this topic around those not fully vaccinated, both adults and those with children under 5 years of age. How have you managed keeping families informed and engaged while new information continues to come out around boosters and pediatric vaccines?
Yeah, thank you for that. I mean, I think, it's the fatigue part is something that I think I hope that I was preparing my team for from sort of the beginning. Like, we're going to be in this for the long haul and the longer haul, even after other people move on. We don't get to be fatigued around things, because, that's the work that we do. And so, we work on a lot around HIV. We're still having new HIV cases. We still have disparities in our communities. We still have deaths in our communities. When others sort of moved on, we're not in a pandemic anymore. And it's like, we're still here dealing with it. So on some level, it's how do we incorporate this into our work and into the overall health and addressing overall wellness within our community, because we're dealing with a lot of heavy things every day, even before COVID, around our families becoming unsheltered, even children being unsheltered, and people being food insecure, and all of the other things that we know that contribute to poor health. And so how do we sort of add this as yet another layer? And how do we really help people understand how to protect themselves from all the things? And so, including, I think what you mentioned before, Dr. Waddell, around when was the last time you had your blood checked? When have you had your blood pressure checked? And when are we making sure? Because we don't have the luxury of ever just focusing on one thing. We've never been able to do that. And so we have to, keep up the fight, while understanding how to really check in with yourself and with your loved ones, and know when it's too much, and know when you need to take a beat, know when you need to hand something off to someone else, and checking in on one another, because it is very heavy. The tragedies that we've been having to just endure and then just show up the next day and keep at it. This isn't normal, and none of this has been normal. And I think trying to make it back to normal or pretend it's normal just exacerbates the situation. So sometimes just naming it and saying, we're in this. I mean, this is heavy. We're in this. And then in terms of, transitioning into folks who are not vaccinated, children under 5, what's going on? I mean, one of the recent updates that happened very quietly is that the primary series of vaccine spacing was increased by the CDC. And a lot of people don't realize that. And so because we've not given up on our unvaccinated adults or unvaccinated individuals who are eligible 5 and up, we still 5 to 11-year-old age group is still the least vaccinated age group pretty much across the country. Parents were trying to wait and hold on. And so what we're trying to do is make sure to keep communicating updates on a regular basis, and arming people with that information, because we think it's reassuring to hear that, okay, the interval between the first dose and the second dose has actually increased to 8 weeks based on what we've learned, based on the information that we've amassed, and that these things are being looked at and studied and improved upon. So if you're just now getting your primary series, you can benefit from, a more effective and potentially even safer vaccine spacing if you are under 65 and you are not immunocompromised. And so being able to continue to update, I think, and stay in communication is so important, so that people just know where to go when they need to get these updates. And it has been a difficult moving target, especially for parents who've been waiting for the under 5 vaccination. Did it work? Did it not? Is it 3 doses? Is it 2 doses? And so luckily, that's right around the corner where we will have that evaluation, likely at least tentatively in mid-June. And so we will finally get that last fully unvaccinated population of ours, our under 5-year-olds, protected, hopefully sooner than later. But there is a lot of information coming at us quickly, and the quality of the data and the information sometimes is, oh, this is a no-brainer. And then other times it's, the downside of a booster, what is that? It's pretty minuscule. The upside could be significant. So a lot of it is weighing out. And I think that this is what has made folks uncomfortable this whole time, and myself included, that we have to make decisions and recommendations without all the information we would like to have. I'm one of those doctors that likes to wait till something's been on the market for 5 years before I prescribe it to my patients, if there's not a viable alternative. And that's not the situation that we're in. So we have to keep on making decisions. Is it 5 months? Is it 4 months? Is it 6 months? Is it a third booster? Is it a fourth booster? So we're just doing the best that we can with the information that we have, and doing what we can to communicate kind of that risk benefit as much as we can.
Yeah, absolutely. And so, information does continue to emerge. The recommendations continue to be updated. We are all anxiously awaiting sort of the final recommendations around for our children under 5. So the CDC website continues to be a good resource for information. Look there early and often. But the other thing that's happening is we're starting to see long-term effects from COVID. And we have a lot of questions around long COVID or post-COVID conditions. And so, of course, the best way to not be impacted by that is to not get COVID. Do your best, in terms of making sure you're fully vaccinated, up to date, et cetera. So I wonder if you all can speak to what we know so far about the prevalence of long COVID, any treatments, any research, and if you all are seeing any sort of long-lasting effects at this point in time in your communities. And really would like to hear from you, Dr. Noah, but also from Stephanie and Alex from that, on the ground sort of unique populations that you're serving also. What are you hearing and what are you sharing about long COVID?
Yes, this is kind of first of all, people doesn't know what it means long COVID, right? I mean, we have to communicate with this long COVID. We did a few webinars to our network of promotores HWs with the experts on so they can be prepared and they can be ready to respond some questions because the symptoms are, I mean, uncertain sometimes. I mean, it is a lot of questioning about vaccines effectiveness because there are people that are having long COVID symptoms for more than 2-3 months, and now they are questioning, and they are the ones to creating this wave of like not trusting the vaccine. So I think preparing the team in how to respond and in how to approach these questions that people has about long COVID are super important because there are still people that needs to get vaccinated. But there is a lot of questions about long COVID. I think this is new in our end. Another thing that have been seen is depending on the area, for example, with the farmer workers, there are other questions. They don't call long COVID, or they don't even call, but it's long COVID. So they have other questions related to the system trust that needs to be addressed as well. So it's been a process, but right now has been a lot of building our understanding because this is new about long COVID. So ourselves be ready in order to provide the community the guidance and how to address questions the community members may have when we're doing the work in the community.
I tell you, this hour goes by so fast. We've got about 5 more minutes before we need to transition. So I want to get as much in as we can. So Dr. Noha, quickly, can you give us sort of the ABCs of long COVID and what you think our audience here needs to know?
Yeah, so the estimates are all over the place, anything from 10% to 30%. We've even seen higher than that. We just don't know yet. And I think the definition is something that is important and will become more, hopefully, defined and described over time, how long it lasts, how much impairment. And so we're really still wrapping our arms, I think, around the magnitude of it. I think what's important is that, any new symptoms, unexplained symptoms, we're wanting to make sure that our doctors are screening folks for new onset diabetes, because we know that has been something that we see post-COVID. And so just making sure that we're staying on alert and we're taking those histories. It's very, very concerning that we, could be really in the midst of increasing the number of people who are disabled because of this. And we are seeing, some of the known complications that really could be around any organ, but certainly cardiovascular, strokes, respiratory issues, neurological issues, and so on. And so this is all very, very concerning. And I think one of the things that we're seeing just on the ground and hearing folks is some folks are hesitant to talk about it. They're worried about, how this may affect their employment. I think we are also encouraging people, just as a practical matter, that if you do catch COVID, that it'd probably be a good idea to have a documented PCR in case you do need any type of benefits in the future for disability. It's early to say, and I don't say that to be alarmist. I say that to be practical because we really don't know what it is that we're facing. And I think we need to wrap our arms around it. So right now we're doing quite a bit of interviewing and talking to folks who've experienced long COVID so that they can share their experiences and that folks can know that they're absolutely not alone. And we are definitely tracking a number of the studies that are going on here in the United States and worldwide to better understand the impacts of this. And the last thing I'll just say about that is that this rhetoric or narrative around, oh, well, we're all going to catch it anyway, First of all, that remains to be seen. Second of all, every time you catch it, is a new opportunity for not only poor outcome, but also for long COVID. And so we don't want to be encouraging people to, oh, you already caught it, you don't need to wear a mask anymore. Absolutely not. We're seeing people catching it more than 2 and 3 times, and there's no necessarily reason why you can't continue catching it. And every time you catch it is another opportunity for potential for long COVID. So we want people to continue to be cautious. Just because you're not worried about necessarily maybe dying, now you feel well protected with your booster. Unfortunately, long COVID is striking people who even were vaccinated. It's striking people who even had a mild or even asymptomatic course of COVID the first time around. So I don't think this is something that we should take lightly at all. We should continue with our vigilance.
Really important points. There is an organization called Resolve to Save Lives, and they've created some videos with some testimonials from folks that have experienced the symptoms around long COVID, and a lot of them are young people. And so again, it's it's the spectrum, and so prevention is the key to the greatest extent possible. A couple of just sort of quick questions. Dr. Noha, does long COVID include those who haven't been able to taste or smell for a year?
Yes, I think until we know otherwise, we know that that is neurological, and we would consider that as part of long COVID.
Great. Let's see. There's a question here about home tests and skewing totals as people are not self-reporting. And certainly that is an issue now that we have more tests available. People are doing testing, but I think one thing that is important to remember is that if someone is getting severe disease and are getting hospitalized, then those test results are being counted. And again, we want to definitely, as we move forward, make sure we're continuing to track severe cases and hospitalizations as a marker of this disease. So finding, that balance is part of what we have to do when you get into, this large epidemic, pandemic type of situation. Can the speakers address how you are supporting people with disabilities in your communities? How about a 30-second soundbite? Let's start with you, Stephanie.
Thank you. Yes. So we have supported so we're very family oriented. We can go back 8 generations ago. So I know that a lot of our grandparents that were stuck at home and they were not mobile, we actually had our nurses physically after work drive to their houses and get them vaccinated. So that's just one of the little ways we've helped our community as we can.
Taking the services to the people. There you go. All righty. Alex, how about you?
Yes, quick. I think seniors has been one of our targets because they have been alone, having services. So many of them has disabilities, technology barriers. They don't even know how to navigate, how to make appointments. So we develop a specific strategy to reaching seniors in our community. Providing the support, having the phone number to call directly a promotora, community health worker anytime if an emergency happens. Also bring food if they need something, even taking to the doctors. Yeah.
Great, thank you. And Dr. Noha, would you like to address that one too?
Sure. Yeah, I think in terms of access, it's so key. And I would echo a lot of what Stephanie and Alex said, that we're doing those things as well. But one thing I think we're really starting to focus on is ensuring that all of the spaces that people go into are accessible for folks with disability, not just from the perspective of, actual access as we think of it in terms of ramps and so forth, but that it's safe and that someone can feel safe going into that environment because the ventilation is good and because masks are being required, because we're caring for one another and we're realizing that we need to be doing mitigations that are going to be protecting the most vulnerable among us. And so we've definitely advocated quite a bit for our public transportation systems, which we're about 50-50 now, of maintaining the masks so that people who have disabilities can feel safe and included in those environments so that we're not continuing to expose them to additional risk.
Great. And Dr. Noha, just a couple of quick questions. Someone is asking, what is the nickname of the subvariant again that you were referring to?
Oh, I don't know about nickname. It's BA
Right.
212.2. Yes. And so
That's right.
it's a long one. And if I can quickly squeeze in, this blood of Jesus is going to save me, because I saw that in the chat, and we hear things like that a lot. And we work with a lot of faith leaders and ask them these questions. And they say that even members of their own congregation say that, and their pushback or comeback to that is, did I teach you that? Because I don't think I taught you that. So where are you also, who are your trusted spiritual advisors? And are you just cherry picking to hear what you want to hear because you're scared of the vaccine? Or is this really your spiritual teaching? And so I don't think we should just be hands off with people's objections. We need to also kind of push them a little bit to kind of really answer the question in earnest.
That's great. And another last quick one, is Paxlovid effective for all variants?
Yes, so far so good with Paxlovid and all variants, and with the way that it works, we're hopeful that it will continue to be, because the part that it works on is a piece that seems to be fairly common to even what we might imagine as a subvariant. But nothing is impossible, and it certainly is possible that at some point it will evade it, or that will develop drug resistance. That is always a very real concern, as we saw sort of with HIV as well. And so I think it's something we just need to be alert on and continue to be vigilant with. But so far so good.
That's great. Well, folks, we are out of time again, and always such a rich discussion with all of you. We want to thank our speakers, Dr. Noha, Alex, and Stephanie, for your wisdom, your time, and your talent, and all that you're doing. We want to thank all of you on the call for your persistence in doing the work, the hard work. We ask that you complete this post webinar survey for us. Your feedback is always important to us, because we want to make sure that what we're doing and providing is helpful to you, as these webinars are in support of community-based organizations. I've seen a couple of chats about the capacity building assistance available through the CDC Foundation. So if that's something that you're interested in, please email capacitybuilding@cdcfoundation.org. And with that, again, our thoughts and prayers to all who have been so tragically affected in Texas, Buffalo, and out in California. And as I said at the top of the hour, enough is enough, and let's get to work. Let's do more. We cannot continue to have our children and our elderlies dying needlessly. So thank you all so very much. And we look forward to seeing you at our next webinar, probably in a couple of months. Take good care.